Greetings. I am Colonel Karyapa. I am a public health specialist and a technical advisor in health. I have served for 26 years with the Indian Armed Forces and am now continuing my passion in pursuing health for the people through a population approach. I will be explaining briefly to you about an outline communication plan to convey current 5 key messages pertaining to COVID-19 over the course of the next few minutes. Who are in the target audience for this communication plan? Well, it is the people of India in cities and in rural areas, those who do not have smartphones, those who cannot access reliable information on prevention measures for COVID-19. And who will convey the 5 key messages? You, dear viewer, you are the one who can and should convey the 5 key messages. What are these 5 key messages? Relevant as on today: wash your hands frequently, follow respiratory etiquette, practice social distancing, believe only in correct sources of information, early recognition and referral for fevers. So in case you were thinking that this is going to be a medical presentation, or you will be having to be the doctor at the peripheries and you will have to administer medicines to someone, well, it is not so. Experts have found that these simple key messages are what is required for us as a community, as a society, as a country to prevent the spread of COVID-19 disease. We will be following the inform, motivate and guide framework for health education messaging. The first part would be informing the individual about what are the key messages. Now you all are the experts at this because you understand the people you are working with. You relate to the people you are engaged with. It must be locally relevant. It must be in the context of the individual. There is no point telling hand washing in a sink or a wash basin to a person who doesn't have running water. Almost no technical details are required to be given about the disease because that would be information overload. You should provide a demonstration subsequently at the guiding stage. Essentially, inform, motivate, guide is a theoretical framework which has got tremendous practical applications. In the motivate section of how you would educate a person, you need to motivate the individual to adopt the key behaviors which are being conveyed through the 5 key messages. This can be by focusing on firstly on the individual, next on this family, and then on the community. The more personal the communications, the more effective it will be. Guiding into action. Informing and motivating are incomplete actions if you do not guide a person into action. That is, show the individual how can he adopt whatever behavior he was informed about. You need to demonstrate at this stage, not at the information stage. You need to ask him or her to repeat and demonstrate what he has learned from you. It must be remembered that just giving information alone is never enough. A person needs to be shown how to do whatever he or she is to do. Just to repeat, these are the 5 key messages relevant as on today. Simple key messages: 1, 2, 3, 4, 5. The communication plan that is being envisaged is to reach out to rural India or Indians anywhere in India. The audience we should reach out or intend to reach out, our priority group would be the Ashas, the Anganwadi workers, the auxiliary nurse midwives. That is, these are the frontline healthcare workers of the government. We need to reach out to them because they further have got their own circles of influence where they can convey the correct messages out. Of course, we also would be reaching out to the population in general, that is, the villagers of all ages. We must keep in mind that the influencing group for us would be at the village level, the village pradhans or other opinion makers. We must focus on the benefits to emphasize, that is, safeguarding the health of individuals and their families, and essentially minimizing out of pocket expenses by unnecessary referrals, unnecessary medications, avoidable hospitalizations through simple preventive measures. We must recognize that there are barriers which would need to be overcome, and these are social media rumors. Do not discount the penetration of WhatsApp and Facebook and other such in rural India or urban India. Everyone today has got a smartphone. If they don't, they know someone who has a smartphone and who spreads these rumors around in the community. We also need to understand that there are and there will be panic reactions to the situation. This can vary across the country. Different regions will have different reactions to the situation. We also need to understand that another major barrier would be existing social practices such as spitting in public, shaking of hands. These are all existing practices. What are the modes of communication? These could be group sessions, small group discussions, home visits, wall writings, interpersonal communication. What is essential to understand is we must always have consistency in what we are communicating across our plan. And we must also comply with whatever government directions or directives that are issued on COVID-19 and other preventive measures. Accordingly, you might need to align your communication messages. IEC material such as videos in Hindi, English, or any regionally relevant language are easily available from state and central government websites. You could also choose videos from any site which are appropriate to what is the current situation, and most importantly, you should yourself verify that they are in consonance with the Government of India's updated position. In case of doubt, please refer to those who can advise you correctly on this, preferably the nearest government healthcare official or doctor. Or within the ecosystem of the Tata Trust, you could have the special points of contact or the regional trainers. Ideally, the duration of such clips should be less than 20 minutes to keep attention span in mind. These clips can be shown on your phone, on the tablet, on a TV screen, or any medium that you feel. You could have leaflets or posters, which can be specifically designed, or they can be downloaded from the Government of India website or the WHO website. You must utilize the five key messages, preferably together or in sequence. This content can be either customized or tailored to the requirement of the region in a contextual manner, while retaining the intent of the five key messages. You will not find these five key messages at any one place on the government sites. These five key messages have been distilled by experts into what is required essentially at today's point of time to be conveyed to the common man. You could make, when you're planning this, information sheets for yourselves or your trainees, which could be in PDF or JPEG in the IMG, Inform, Motivate, Guide format, to be carried on mobile phones or tablets, which are based on the five key messages, which will allow you to refer till you get comfortable with delivering these. But I'm certain and I am very clear that you all will be able to do this because this is what you do on a daily basis. That is, engage with people. If you feel for the people, you will engage with them. I am just suggesting here that we need to use this scientifically and do it in a structured format. Each one to teach many. And the trick would be to keep it simple. Together, we all can fight this coronavirus by reaching out to our people.